You're passionate about helping practitioners specifically feel confident about supporting those with cancer at every stage of their journey. And I thought this was interesting. 1 out of every 2 people will get diagnosed with cancer, and 2 out of 3 will survive it.
Yes. So
Yes.
that's the bad news and the good news.
Yeah.
So think about it. You're sitting at a dinner table. Half the people at that table either have had cancer or are going to have cancer. That's daunting. And because diagnosis is earlier these days, and because we have more focused, personalized treatments and can support people to get through their treatments, come out the other end doing well, then a lot of people are living quite a long time, not only surviving, but some people will live with cancer as a chronic illness for a long time as well. So there's a large population of patients that really need health support. And the reason that the cancer incidence is so high is because of our toxic environment,
Yeah.
our unhealthy lifestyle, sedentary lifestyle, and really the levels of stress that people live with as well, disrupted sleep cycles, all these things compromise our immunity.
Mm-hmm. You created the OutSmart Cancer System. Tell us more about that.
Over the years, as I began to work with patients whose lives have been touched by cancer, I developed a system and a way of teaching patients how to care for their health, a way of monitoring blood tests and biomarkers. In integrative cancer care, we think about the cancer terrain or the tumor microenvironment. So we want to be able to monitor that and optimize that. And the real goal is to create a biosystem that's not going to host cancer, right? That's not going to be hospitable to the development or proliferation or progression of cancer. And so we want to have a way to monitor the patient's status so that I know that the treatment plan I put together for them is actually meeting those goals. And so the care has to be highly individualized. If you have a person who's a diabetic with cancer versus somebody who has autoimmune disease and cancer or depression and cancer, then we have to really tailor that treatment plan to the patient. And we do that by talking to them about self-care, about the emotional side of being diagnosed with cancer and the fear that comes with that, the fear of recurrence once you finish treatment. We talk to patients about diet, and we have an OutSmart Cancer diet approach that is to transform this biosystem in cancer terrain. And then we have nutraceuticals and botanicals and phytochemicals that go along with that. Sometimes we'll refer to a physical therapist or an acupuncturist as well. Our job is to educate the patient, make sure they have the right team, including the right oncologist, and make sure that they really have a plan to have a good outcome and a stable future.
Yeah, and one thing you just mentioned, to work with their oncologist or make sure they're working with the right oncologist. How do you, as an integrative practitioner, collaborate with an oncologist? Because many oncologists don't want patients doing anything outside of what they're doing. How do you work with that?
It's an incredibly common question that I get asked. I'm all about relationships. And the first thing that I'll do is I'll introduce myself to the oncologist and I'll say, you're the disease expert, I'm the health expert. And that makes them feel I'm not stepping on their toes.
Mm-hmm.
And there's a lot of confusion, I think, in oncologists think that we are claiming that we're treating cancer, but we're not.
Right.
That's not what we're doing. We are preparing the body to have a good, robust response to treatment and to stay healthy and resilient and recover. And so once I make that clear to the oncologist, quite often they take an exhale and feel okay about it. Of course, I've been in practice 35 years now, so I have relationships with oncologists. And once you've shared patients with a physician and they see that those patients do better with this kind of support, then you don't have to say anything. But it's important to reassure them. I let them know I'm well-versed in drug nutrient interactions, and then my intent is to not interfere with their treatment goals, to respect what they're doing, but to really support the patient, and then it's win-win. The oncologist, the patient, and our team, everybody wins when the patient does better. And so create these partnerships. And of course, some doctors are open and some are not. But, that's been my mission, to have a seat at the table, to have our voice, our point of view included.
Yeah, I think that's beautiful. And I think it's encouraging to practitioners that we can form this integrative team, right?
Yes.
So, some of the unique needs of these patients, you already mentioned, the fear of recurrence and having that mental emotional aspect, restoring normal function. But I know you've also talked in lectures about sleep cycle disruption and microbiome restoration. I'd love to talk more about each of those, starting with restoring normal function. What does that look like to you?
Well, it sort of depends what the patient has been through, but we want the patient to have normal digestion. Quite often, the digestive tract and the microbiome have been very disrupted. Some treatments, like a lot of chemo, causes the epithelial lining of the GI tract to slough off, and then we want to be able to repair that. Sometimes patients get gastritis and enteritis or mucositis in their mouth, and they just have a hard time eating, or that some patients have a lot of scar tissue in their abdomen and have abnormal peristalsis. Everyone who's ever had chemo has microbiome disruption. So those have to be included. But if you think about it, nutrient status, caloric status, protein status. These are so important to being able to withstand stressful treatments, to heal from a surgery. Right? And so we often put together like a therapeutic shake as an insurance policy, because a lot of these patients don't feel like eating, they don't feel like cooking, eating is uncomfortable for them. So I want them to get those nutrients and calories. So kind of do a super shake, and have protein powder and reds powders, greens powders, MCT oil. Always put carnitine in the shake, because loss of muscle mass and sarcopenia is a big risk for all cancer patients. So the carnitine not only supports muscle mass, but mitochondrial function and the fatigue that comes with cancer. So it can be kind of simple to do it. And then the patient has a way, especially on the days they don't feel like eating at all, maybe take 2 shakes or 3 shakes and still get enough calories and nutrients.
Yeah, I was going to ask you about that shake. I
Yeah.
know you're a big fan of that
Yeah,
one.
yeah.